I dislike the current healthcare system as much, if not more, than those who want to create a single payer system for healthcare. But the problem with healthcare in this country is too much government. We do not have a free market in medicine or insurance. Here are 12 ways to drastically improve healthcare in this country and get us closer to an actual free market. 1. Unlink insurance from jobs by getting rid of the current tax incentives. This will help to create a more open and free market for insurance, while also reducing gaps in coverage that occur when people lose their job. 2. Create 50-state competition by deregulating insurance markets in all 50 states so there's some uniformity in law, and get rid of laws that hinder cross-state competition. 3. Massive deregulation of insurance. Especially stop mandating that non-risk related things be covered. Insurance isn't supposed to cover chronically anticipated events. Insurance's purpose is consumption smoothing and risk aversion. Can you imagine how much auto insurance, mechanics, and gasoline would cost if your insurance covered a gas fill-up, a tire rotation, or an oil change? Take Obamacare and pre-existing conditions as an example. The pre-existing conditions problem started with FDR and World War II wage controls. There were maximum wages instituted, so employers had to offer their workers non-pecuniary benefits to attract labor, so they offered benefits like insurance. Now this problem is solidified with tax incentives. So, untie insurance from one's job so there's no gaps in coverage. The gaps in coverage from job changes is why, for the most part, pre-existing conditions are an issue. A true free market will lower prices for insurance premiums and will increase wages for people because businesses no longer have to provide insurance as a non-pecuniary wage benefit. The free market can also give option contracts to people who buy their insurance. They get the right to buy at a set price in the future. You could also give tax incentives to health savings accounts. We shouldn't turn the system upside down to help some people at the expense of higher premiums for everyone when there are better solutions to helping the demographic of people who have a pre-existing condition. Massive deregulation leads to lower medical costs and more price transparency, so insurance costs less, and buying things without insurance or things that insurance doesn't cover also costs less. There's also risk pools and Medicaid, etc., that could fill in gaps if you absolutely must have a government plan. Ideally, replace these with a negative income tax, which I will talk about in point 4. The free market can solve a big part of this problem, and private charity or other government programs can fill in the gaps of what's left. We don't live in a perfect world. So, as economist Thomas Sowell said, there are no solutions, only trade-offs. People with pre-existing conditions aren't entitled to government force and coercion to protect them. They should, however, be entitled to a government that protects contract and association rights that lead to more efficient and affordable healthcare. 4. Replace all welfare with a negative income tax, and I mean all welfare. This would be a more cost-effective way of helping the poor by actually giving them money instead of countless government programs. There's a reason why around 80% of economists support an NIT.
The proposal for a negative income tax is a proposal to help poor people by giving them money, which is what they need, rather than as now, by requiring them to come before a governmental official, detail all their assets and their liabilities, and be told that you may spend X dollars on rent, Y dollars on food, etc., and then be given a handout.
5. Abolish licensing for doctors. Licensing doesn't assure quality. Things like board certification do. Licensing just restricts the supply of doctors and therefore increases prices. Licensing also prevents qualified doctors from working in other states and further hurts competition and prevents them from working during pandemics or natural disasters. During COVID, the government eased up on some of these laws because they saw how stupid they are. The free market assures quality, either private certifications that are more effective or efficient than government ones, or how any business works. Consumers know who is bad and who is good. The bad ones go out of business, and the good ones keep getting better from competition. Currently, the government crowds out private certification programs and has a monopoly on the licensing process. This creates a government-enforced labor cartel that creates higher prices for everyone. 6. Abolish the FDA. They kill more people than they save by focusing on type 1 errors and not type 2 errors. They prioritize only preventing a bad drug from coming to market, and in the process prevent good drugs from coming out in time or at all, therefore killing the people who needed it. The economic studies are incredibly clear. On net, the FDA kills hundreds of thousands of people as a result of this. The private sector maximizes the number of lives saved and allows individuals to decide risk for themselves. The FDA prevents good drugs from coming out in time to save people. Individuals know their situation the best and should be able to use their ideas about risk to make decisions, not the government's ideas on risk. It should be up to you to decide what you put in your body, not the government. 7. Free trade for drugs. This creates more competition and reduces prices and increases quality. 8. Get rid of government barriers to entry for new hospitals or clinics to be opened, and certificates of need laws for ambulance competition, medical imaging, hospitals, etc. These laws are just ridiculous government protectionism.
Can't have too much competition because businesses will start cutting corners. And that's just absurd. We now recognize that competition leads to efficient outcomes.
Not in states with con laws, where patients wait.
Those are precious minutes to the consumers who would benefit from ambulances.
Not just ambulances. 35 states have con laws for things like medical imaging companies, hospitals, even moving companies.
Once you get these laws on the books, it's very hard to get them off because the monopolies like their monopoly.
9. End the corporate business tax. This tax is not paid by medical and insurance companies, but by shareholders who get lower returns on their investments, as well as the consumer and employees through higher prices and lower wages. 10. End Medicare and Medicaid, but replace them with a negative income tax. 11. Encourage health savings accounts with tax incentives and tax deductions for healthcare. And finally, 12. Possibly some malpractice reform to reduce the number of tests doctors perform that are driving up prices. Sadly, we won't see any of my reforms. Government and its programs only grow and change. They never shrink. Regulations and programs will keep being stacked on top of each other, while everyone's health and well-being suffer. Having more government and creating a single-payer healthcare system is not the solution. Government is the problem.
If you want something cheaper, you can always get something cheaper. It's just that you're not going to get the same quality. In order for them to bring down the cost of healthcare, the government would have to operate the system more efficiently than the market does. I can't think of anything that the government operates more efficiently than the market does.